Almost 1 in 6 people around the world have a headache on any given day. Oh, is that you today? Let me know. About half of those experience a migraine, researchers have found. So headache disorders, oh my goodness, and I've suffered, can be painful, debilitating, and have myriad causes from stress to overuse of medication. Now, a large-scale review has highlighted just how common such conditions are. So the results have been published in the Journal of Headache and Pain, and it suggests that more than half the world's population, 52%, have an active headache disorder, typically described as experienced some kind of headache during the last year. So further analysis revealed that just under 16% of people around the world have a headache on any given day. Well, many of the studies did not report the type of headache involved. It did suggest around 7% of the global population experience migraine, and almost 9% have a tension-type headache. Are you affected? Let us know on 4001. Get your symptoms in, what you've tried, because joining us live on the line now is Dr. John Ulawali, the specialist neurologist at King's College Hospital here in Dubai. Dr. John, how are you?
Great. Thank you, Helen. Thanks for having me.
Absolute pleasure. And now I need to ask you, do you suffer from headaches yourself? Have you ever been afflicted?
No, I do not suffer from headaches on a regular basis. But then, of course, I've had headaches before. So virtually everyone has had, at least half the world population must have had headache at one point or the other in their lifetime.
And I've suffered from, headaches, just your normal kind of tension, stress headaches. But I've also had migraines in the past. Interestingly, and I do not recommend this as a cure, by the way, having children seemed to sort it. I used to get a lot more migraines before I had my first child. And we've had a number of questions asking about hormones, about diets, about light. So we're going to talk about some different causes over the course of this afternoon. But if you've got any questions for Dr. John, please do get in touch. So this survey that suggests that 1 in 6 people listening today has a headache. Are you surprised by this result, or does this seem pretty much in line with what you're seeing coming into clinic?
Yeah, it's pretty much in line with what I see every day in the clinic. Up to half of the patients who walk into the neurology clinic on a daily basis have got some form of headache, be it migraine or other kinds. So although we know that what you call stress headache or tension type headache is the commonest form of headache worldwide, but then migraine is the commonest reason for which headache sufferers will present to the clinic. The stress headache or tension type headache most of the time are quite mild and wouldn't stop people from their daily activities, and they can easily handle those. But those who come to the clinic seeking help, most of them have got migraine headaches, and at least 1 out of every 5 women has got migraine, so it's extremely common. So if you step outside now and randomly gather 5 women, at least 1 out of them would have migraine.
Why are we suffering from the migraines, Dr. John? Can we blame the men, or is there something else going on?
Well, it's just, so that women suffer more from migraine. I think it's the proportion is about 3 to 1. So
yikes.
For every 1 man who has migraine, there are 3 women who've got migraine. So like you mentioned earlier, it has a little bit to do with hormones, because what we noticed is in the early years, children as young as 5 or even 4 have been reported to have symptoms of migraine. And it's about equal. The prevalence is about equal up to puberty. So once they reach puberty and they start to menstruate, then women begin to have a higher prevalence than boys. So I think the effect of hormones is hormones have a very good role to play in the prevalence of migraine.
I think it's really interesting as well to note that just how serious migraines are. It's the second leading cause of disability in the US. And I think anyone who's really had what I would call a proper migraine, and perhaps you would have a different kind of diagnostic description for that, it's horrendous. I used to get them and wouldn't be able to drive. I'd feel sick. My boss would go, I just go home and, watch some TV and relax. And I'd be like, there's no way I can watch TV. I would literally be with my head in between the sofa cushions trying to muffle out any kind of light or sound. So from a neurological point of view, what is the difference between a headache and a migraine, Dr. John?
Right. So it's very much related to your earlier question about what causes migraine. So what I say to my patient is, there was a patient whom I asked, what do you think migraine is? And the answer she gave me was very funny. I mean, that was the first time I actually laughed in the clinic. And she was like, migraine is like the top most rated headache. And I started laughing. So actually, migraine is that genetic tendency to have headaches of certain kinds without an underlying brain disease. So these individuals, even though structurally speaking, their brains look normal and comparable to the brains of other people, but these individuals have headaches even under normal circumstances. So they're just prone to having headaches, and that's what migraine is. So these individuals have got a vulnerability to headaches. Now, headaches are of different kinds. So it's not all headaches that are migraine. So when we say migraine, migraine could refer to that genetic tendency to have those forms of headaches. And we have some classical characteristics of those headaches that we refer to as migraine headaches. So not all forms of headaches are migraine. So the migraine headache would typically, it could affect one side of the head. That's like the commonest presentation. Although it could also affect the entire head. It's usually moderate to severe. It's throbbing. There's light sensitivity, sound sensitivity, nausea, vomiting, and a few other things that are associated with migraine. So migraine is just a type of headache.
We are talking headaches this afternoon, and for some, a headache might mean that you need to pop a pill, but for many among us who are affected by more persistent and serious head pain, a new study has now estimated the extent of this disorder worldwide, and the data is staggering. The team came from the Norwegian University of Science and Technology, and it summarised headache studies from 1961 to the end of 2020. I think there have probably been a few more headaches between 2020 and today. And this data included general headaches, migraines, tension-type headaches, revealed that 52% of us suffer from some form of headache disorder every single year. And on each day, 15.8% of the world's population had a headache, the authors grimly point out. Well, joining us on the line now is Dr. John Ulawale. He is here as a specialist neurologist at King's College Hospital. And I have to say, Dr. John, lots of people getting in touch with all sorts of different symptoms and suspected causes as well. Emma's saying, I suffer from headaches regularly, mainly caused by sinuses. My doctor says my sinuses aren't infected, but I get pain across my nose and face. My ears often feel full and the pain runs down my neck, under my ears, the bottom of my skull. It's very unpleasant. How do I ease this pain? John, I think this almost should be two parts to this question. One is easing the pain, but one is, why is Emma getting this pain in the first place?
Okay, so responding to that question about pain on the face, the nose, and fullness and all of that. Yeah, it's known that sinuses can indeed cause, or sinusitis, as we call it, that's inflammation of the sinuses, can indeed cause headaches. However, if it's becoming recurrent, then there is a chance that there might be an underlying primary headache disorder like migraine. It's often a mistake to think that people make, thinking that when you have regular headaches of this nature, then the sinuses are responsible. So it's worth seeing an ENT specialist to examine the sinuses and see how things are. And if they think the sinuses are all right, then you might need to see a neurologist to look into things. There's a high chance that you might have an underlying migraine that needs to be addressed.
Can we talk about triggers, in migraines in particular? But Marge has been interesting. I've received advice from a friend in the past to reduce dairy products as this could trigger headaches and migraines. Is there any truth to this? I've heard this too, but it's hard to separate internet information from actual information sometimes. So as a neurologist, can we talk about diet and the impact it has on headaches and migraines?
Right. So it is true, actually, that there are some things that trigger migraines. If those got migraine, that's tendency to have headaches. It's always good for every individual to observe themselves and see what tends to trigger their headaches. So a lot of people place emphasis on, food, chocolates, dairy products, and all of that. But what the current knowledge has shown is that it's actually not these foods that trigger migraine. It's actually that in the few days preceding an attack of migraine, there is a change in the internal physiology, and that makes individuals to begin to crave some of these foods.
Interesting. So, like chocolate, for example.
Yeah. So it's just the habit that changes. They have us craving for such foods. And then when they eat such just before the headache starts, then they begin to associate it with the headache. So it's a change in desire that is brought about by what we call the premonitory phase of migraine. So nowadays we talk about 4 phases of migraine. The premonitory phase, in which you have some symptoms that predate the headache, like craving, getting tired, yawning, and all of that, just before the headache starts. And then we have a headache phase. We have what we call aura, which can happen. And then the final phase is the post-dromal phase. After the headache is gone, some people continue to have, extreme tiredness, difficulty concentrating, like brain fog and all of that. So all of these are associated with migraine. So I do not place so much emphasis on certain kinds of food as I do on some other forms of triggers. Like we know exposure to bright light in some people can trigger headaches or trigger migraine. Stress, dehydration, hunger and all of that.
Well, we've got a couple of messages on 2 of the topics you've just mentioned there, John. Afia is saying, I get the worst headaches when I head out on a sunny day. Makes it worse if I'm in the passenger seat of a vehicle rather than driving myself. I avoid popping a painkiller as often. I don't want to get too dependent. The only thing that works, apart from medication, is tying a cloth really tightly around the spot it's hurting and sleeping it off. Are these migraines, and what changes could I do to reduce it? I don't know, I've never heard this kind of pressure points of tying a scarf around it. Is that something you'd recommend, or that you've seen or even heard about working in the past?
Yes, certainly. There are so many things that help, non-medication options, or they can actually complement your medication when the headache is going on. So certainly these kind of things help, like putting pressure on the area. Some people put cold things on their heads, staying away from noise, staying away from light. So all of these help the migraine to subside quickly. So yes, it's something that's often practiced. Sometimes breathing exercises and so many other things. So drinking water, and some people drink ginger. And there's some scientific data to support some of these interventions.
What about things like pressure points? My granny's thing was, that kind of fatty pad you've got between your index finger and your thumb, to squeeze that when you've got a headache. Is this just an old wives' tale from my Welsh granny, or is there any truth in some pressure points that can release tension in, I guess, maybe just trying to think physiologically, maybe that's releasing tension up your arm, into your shoulder, into your neck, into your head, or was she just trying her luck with me?
Well, I think it might work for some people, but not for everyone. So if you try that when you have headaches and it works, then that's fine. Because the whole idea is trying to counter the pain sensation. So perhaps if you imagine a gate, we've got a gate theory of pain. If you imagine a gate and people are trying to force their way through, so the more the number of people are trying to force their way through, the higher the resistance. So perhaps you're putting pressure. So that pressure sensation passes through the gate, the pain gate, and then makes it more difficult for the pain pathway pain sensation to go through. So it's like countering the sensation. So I think that helps. That helps in some people, but not everyone.
All right, Granny Jean, I'll give her that one. We are talking headaches this afternoon because about 1 in 6 people will have a headache on any given day. This is according to a new study that is trying to understand the extent of the condition worldwide. That research involved examining nearly 60 years of studies, and it found that nearly half people who took part will have a migraine at some point. And joining us on the line now is Dr. John Ulawali. He's a specialist neurologist at King's College Hospital, Dubai, to answer your questions and mine about everything from causes to some strange symptoms that you might be having. Interesting question here from Remy. Dr. John saying, I've had headaches and migraines on and off for 20 years. I've noticed this time in the first 2 days of fasting for Ramadan, my headaches went down to the point where I usually have to take up to 5 tablets a day for my headaches, whereas at the start of fasting, I only took 1 or 2 in the day. Then they've started increasing again when I had to break my fast for a few days. Why is this? Does that ring any bells with you, or have you got any medical explanation for what Remy's going through?
Right. Actually, what Remy is going through is the opposite of what most people with migraine or regular headaches experience. So most people with migraine tend to have more headaches during fasting, and the reasons are that possible reasons are that during fasting people take less water and they tend to be dehydrated, and that's one of the triggers for headaches. And the stress of fasting as well. The stress predictably makes headaches worse, and then low sugar associated with not eating regularly, and the sleep pattern tends to change in Ramadan. So all of these make headaches worse for most people. Mm-hmm. But what Remy is experiencing is the exact opposite. So I think there must be something that she's doing now during Ramadan that she wasn't doing before that's helping her headaches. And it probably has to do with lifestyle, because lifestyle has a lot of impacts on headaches. So if she can observe herself and her lifestyle now during fasting and try to take away one or two things from there, that might be helping her headache, so that after Ramadan is over, if she continues to practice that, then that could help. Perhaps she's now paying more attention to relaxation, resting, maybe meditation, or perhaps making sure she's well rested during the day. So perhaps there must be something she's doing now that she wasn't doing before.
Ooh, Remy, let us know. But yeah, I think that's a really interesting point. It might be relaxation. It might be less time in front of the computer. So yeah, Remy, let us know. Lots of messages for you, Dr. John. We are going to try and get through as many as we can. No name on this one, and you can be completely anonymous. There's one saying, most of my adult life have been ruined by headaches around 15 days each month, some concurrent. At the age of 52, they're lessening. Many have been migraines, and my sick record at work was poor. Doctors showed little interest, however. Truly, my life has been ruined by them, and I'm glad to see research being done, but it is too late for me. And thank you for that. I'm so sorry you've been going through that. And Jane getting in touch, a similar age, saying, I've been suffering with increasingly worse migraines for years, lasting 3 days, and I'm completely floored by them. They're hormonal, so a hormone supplement has taken the edge off them, but they're still debilitating and make me miserable. I've tried multiple other drugs, but nothing has had any real effect. A gynecologist has suggested that ultimately hysterectomy plus HRT could be an option, as I'm old enough to be approaching menopause, but I'm reading mixed reports so far. Can we talk about that hormonal piece there when it comes to causation? You said earlier, if one man has a migraine, there's probably 3 women who have got a migraine at the same time. And I mentioned anecdotally, there's no evidence around this, but I had a lot of migraines before I had children, and I certainly do not recommend having children in order to cure your migraines, because you'll get headaches instead. But why are hormones so crucial to, well, the impact that we might be having when it comes to headaches and migraines?
Right. So thanks for the question. I really feel for Jane what she's going through. So estrogen is one of the hormones that women have in excess, especially before menopause in the reproductive years. So estrogen is known to promote headaches of migraine. And that is why sometimes when some people come on the pill, they tend to have more or worsening of their migraine. And some people as well, around their period, when they're getting ready to menstruate, then they tend to have worsening of their headaches because of the changes in estrogen levels. The same thing is observed in pregnancy. In the early, weeks of pregnancy, typically the first trimester, it's possible for migraine headaches to get worse initially because the estrogen levels are rising. And then once it stabilizes in the mid-trimester, most women tend to improve. So, and then after giving birth, again, the levels start to drop, and that again could cause worsening of headaches. So we think it's the perturbation or the disturbance in the levels of estrogen that worsens migraine in this condition, and not necessarily whether it's increased or reduced. But when it's rising or falling, then it can potentially trigger migraine. And then for people around menopause, because estrogen levels are declining fast, that can also be associated with worsening of migraine headaches. So, like she said, that her gynecologist suggested trying estrogen, or hormone replacement. That could help, but that she could explore that option. But if it doesn't work, then she might need to see a neurologist who certainly can explore other options that could help to reduce the number of headaches. Because this is quite a lot, 15 days a month or 15 headaches a month is a lot. Yeah. And that's what we call chronic migraine. When someone has reached that point of having 15 headaches or headache days in a month,
that's terrible.
The person has transitioned to chronic migraine.
Okay, Jane, all the very best with that. I really do wish you well in exploring this and treating it. Sana's got in touch with a bit of a mystery situation for you, Dr. John, saying, I was told my headaches are caused by my carpal tunnel in my wrist and TMJ. Can you ask the doctor how carpal tunnel could affect my head? What do you think about Sana's? We're going to have you as our Dr. House this afternoon, putting together some mystery symptoms and pains. Does this make a connection in your brain?
Well, let me start from TMJ. We know that TMJ problems, when we say TMJ, that's, for those who may not know, that's the temporomandibular joint. So that's like the joint that we move when we chew. If you put your hand just below your ear, and then you make chewing movement, you can feel that joint there. So a lot of people have problems with their TMJ, and that could actually cause headache, because headache is head pain anyway. So anything in the head that generates pain can give you regular pain, and that can mimic migraine. And in those who have pre-existing migraine, it can make it worse. So if you see an expert in TMJ disorders and they treat that, if that's contributing to your headaches or contributing to the worsening of your headaches, then things should improve. Now about carpal tunnel, that's quite far away from the head, so it's very, very unlikely to be contributing to headaches. The only connection I can possibly think is perhaps if there's so much discomfort around your wrist and your hand, and that's affecting your sleep quality, because we know that those who've got carpal tunnel syndrome tend to have a lot of pain in their hands, a lot of numbness, tingling, especially at night. So that could reduce the quality of their sleep. And of course, migraine is extremely sensitive to sleep quality. The poorer you sleep, the worse your headaches become.
Interesting. And in terms of connections, a message here saying, regarding Remy's mentioning of having fewer migraines during Ramadan, I have the same. It might be something she's not eating, as in a food that normally triggers it. Interesting point there. Dr. John, before I let you get back to your busy clinic at King's, for anyone who is prone to headaches or indeed wants to prevent them in the future, is there anything we all should be doing or trying or taking that you would like to see the Dubai population giving a go?
Right. Thank you so much, Helen, for asking that question. That's very important. So it's not entirely about medications. So probably there are 2 points I need to make in relation to that question. The first one is about medications. So we usually don't want people taking, medications more than is necessary or more than is safe. So we consider the fact that if you're taking painkillers for more than 3 days a week, then that's a signal that you need to see your neurologist. They need to do something to help bring down the number of headaches, because that can potentially cause medication overuse headaches. So it's like a rebound of headaches. Now about the other things you mentioned, yes, there are so many lifestyle factors that have roles to play when it comes to migraine frequency and migraine severity. So I will use the acronym SMART, being smart about your migraine. So S stands for sleep. So sleep is extremely important. Every adult needs to sleep for at least 7 to 8 hours every night. So, and what I say to my patients is that has to be sufficient and consistent. So you need to sleep sufficiently and consistently, so about 7 to 8 hours. And it's better for migraine sufferers to actually have a regular schedule. So I go to bed at 10 and I wake up at 6, for example.
Get that routine. And what's M then, Dr. John? If S is sleep, what's M?
Yeah, M has to do with meal. So of course we can't talk about meals now during Ramadan, but normally the meals have to be regular. So you don't miss your meals. You have your regular breakfast, your lunch, your dinner. Don't skip meals, because when you skip meals, that hunger, low glucose can be triggers for migraine.
And A?
and that also includes water. So water is extremely important. So you need to drink at least 2 to 3 liters of water every day. That improves migraine a lot. And then A has to do with activity. So we need to be physically active. So at least find a form of exercise that you can do to keep you active. And then R has to do with relaxation techniques. So stress is a major factor when it comes to migraine. So virtually everyone has got their own triggers, but then stress is something uniform to everyone that's got migraine. So stress makes migraine worse. So you must find a way to handle stress, stress relaxation techniques. And the T is triggers. So it's good for every migraine sufferer to try to identify their own triggers by taking their time to observe themselves, perhaps keeping a headache diary, and that way you can know what happens in the days you've got headache, what distinguishes those days from other days, and you might be able to identify what the triggers are, and you try to avoid the triggers. So these are some of the things that people need to look at or take care of. And if you've done all of these and things are not getting better, then of course you need to see a neurologist.
I think that's exactly right. I think, talking about how common these issues are, so many people out there just thinking it's normal to have a headache and be in pain every single day. Well, some great doctors here in the UAE, and I thank you for your time this afternoon, Dr. John. Really, really appreciate it. Some great advice, some great answers to some of the messages coming in. And I have to say, judging by the number of texts, an awful lot of people suffering an awful lot from headaches. So thank you, John. Really, really appreciate it. And you can find Dr. John Olawale there, specialist neurologist at King's College Hospital, Dubai.